Okay. So this started, I'll go and join.
Okay. Good evening, everyone. Welcome to today's episode of the College of American Pathologists Foundation webinar on process improvement and risk management in laboratory quality management system. My name is Dr. Onyinye Ezinne. I'm a consultant hematologist at Teaching Hospital, Parkland, Enugu, and the State Director for National Blood Service Agency, Enugu. So today we are going to discuss process improvement and risk management in laboratory quality management systems. And our learning objectives will be understanding the principles of Lean and Six Sigma in laboratory QMS, implementation of process improvement strategies for enhanced efficiency in the laboratory. You're going to learn how to conduct effective root cause analysis and implement corrective and preventive actions. Develop proactive risk management strategies for laboratory quality enhancement. And last but not the least, enhance laboratory compliance and quality through continuous process improvement. So before we proceed, we're going to go through some pre-assessment questions. Number one, which of the following to assess your knowledge of this particular topic we are going to go into? Doesn't carry any score, it's just to have a baseline knowledge of your understanding. So question number one goes forth. Which of the following best describes the role of lean methodology in laboratory process improvement? A, increasing the number of laboratory procedures to maximize productivity, eliminating waste and improving workflow efficiency, reducing quality control checks to save time, and replacing ISO 15189 requirements with internal policy. Question number two. How can a laboratory address low turnaround times while promoting continuous improvement? A, implement an advocacy campaign to raise awareness about laboratory processes. Introduce digital reporting systems to streamline communication with stakeholders. Focus solely on training laboratory staff to handle complaints more efficiently. D, increase the number of laboratory personnel to reduce workload. Now, question number three. To implement proactive risk management strategies, which of the following is the best approach? A, conducting risk assessments only after a serious incident occurs. Implementing preventive measures before issues arise. C, focusing risk assessments only on tests with known high error rates. D, reducing staff involvement in risk management to avoid unnecessary workload. So like I said, it doesn't carry any score. It's just for us to have a baseline assessment of your understanding of the topic we're going to discuss today. So by way of introduction, laboratories play a critical role in healthcare and require efficiency, accuracy, and reliability. These three are critical elements in laboratory operations. Laboratory excellence is very essential for delivering high quality, accurate, and reliable diagnostic services while ensuring safety, and compliance with laboratory standards. QMS, as we all know, quality management system, ensures standardization, compliance, and quality and continuous improvement. The two key pillars that drive excellence in the laboratory are process improvement and risk management. And these two are what we are going to focus on today. Both of these help labs to achieve better patient outcomes, reduce errors, and get them to be accreditation ready. So I'll be using process improvement and process optimization interchangeably. What is the importance of process improvement? Okay, process optimization focuses on refining workflow to enhance productivity. It also reduces error and improves turnaround time. It minimizes waste and prevents unnecessary resource utilization. It also gets the laboratory to align its operation with accreditation standards such as ISO 15189 2022, College of American Pathologists, WHO, and the rest of them. Okay, let's briefly introduce the importance of risk management because we are focusing on these two today. Risk management helps identify, assess, and mitigate risks before they impact patient care. It also ensures that labs comply with regulatory requirements, and while doing that, it enhances patient safety. It moves the laboratories from a reactive problem solving to a proactive risk prevention laboratories. What is the interrelationship between these key elements for optimizing laboratory performance? Process improvement enhances efficiency and reduces error. Okay. While risk management prevents potential risks from happening in order to ensure patient safety. Regulatory compliance also ensures adherence to industry standards, and these all work hand in hand to ensure that laboratory performance is optimized. So let's talk about the Lean and Six Sigma for process improvement or optimization. These are the two key tools for process improvement or optimization in the lab. Lean focuses on getting rid of wastes, improving workflow in the laboratory, and also creating value. Thank you. We'll get to discuss what we imply by wastes in the laboratory. Wastes are, we'll discuss them in details, but by way of introduction, they are unnecessary motions, delays. In fact, I will call them non-value adding activities in the lab. And this lean method of process optimization originated from a non-medical industry, the Toyota production system. They were using it to improve efficiency in their processes and also to eliminate waste in their processes. Okay, let's look at Six Sigma. Six Sigma focuses on minimizing errors, improving quality, and ensuring that data-driven decisions are made. It also targets near perfect performance with fewer than 3.4 defects per million opportunities. We'll get to discuss that at a more deeper level as we go on. This Six Sigma originated from the Motorola industry. So let's focus on lean. Like I said, it originated from the Toyota production system and is centered around the idea of eliminating waste in all forms. It focuses on streamlining processes, improving workflow, and ensuring that every step in the process adds value. So we are interested by what Lean is interested in doing is to make sure that the processes add value at the end of the day in the laboratory. Lean ensures that we don't indulge in wasteful activities in the lab. So its principles aims to reduce inefficiencies such as unnecessary motions or movements, all forms of delays, overproduction, or underutilization of resources. By identifying and eliminating waste, Lean helps to improve operational efficiency and cost effectiveness, which is particularly valuable in lab settings where time and resource management is very, very crucial. Now, let's look at the 8 wastes in Lean, often remembered by the acronym downtime. These wastes represent inefficiencies that hinder productivity and quality in the lab. And they are as follows. The D represents defects. And these defects are errors in test results that lead to inaccurate or unreliable data. These defects require rework, re-verification, and corrective actions. And all these cause delay in the processes or in the activities in the laboratory and reduce overall quality of laboratory results. Now, the O is overproduction. This implies conducting unnecessary tests and duplicating tests that does not add value. Overproduction wastes time, resources, and increases costs without improving patient care. For example, one of the examples I will cite here is maybe in a hematology lab doing PCV and HB. Both of them give the same there is the same thing, is the same outcome. Okay, so why do HB and PCV for a particular patient in a hematology lab? And also when, for example, you're doing 2 markers of hemolysis at the same time. Okay, so those are the examples I can cite for overproduction. Then waiting, delays in sample processing, such as waiting for reagents, equipment, and approvals, which leads to increased turnaround time and affects the timely delivery of test results. Okay, remember that we are trying to explain the 8 wastes in Lean because this Lean methodology, it can be applied when you are able to first identify the wastes in Lean, then you can be able to now streamline your operations to cut off the waste so that there will be efficiency in the workflow, which is what Lean methodology is all about. Now, for the N is non-utilized talents. And this means underutilizing the expertise and potentials of the laboratory staff, such as assigning tasks that do not align with their skills or expertise. These wastes reduce their morale, the morale of the staff, and it can also lead to inefficiencies in their operation. T is for transportation. This implies unnecessary movement of samples, reagents, or paperwork in between departments or workstations. And you know that waste time, and it can also increase the risk of contamination of samples in the lab or even misplacement of samples. Inventory. I is for inventory. And this implies either overstocking or understocking reagents or consumables or other materials that are required for testing. Poor inventory management can lead to delays, increased costs, and the risk of expired or wasted materials. Now, let's talk about M for motion. Motion translates to inefficient workflows that require excessive movements of staff, samples, or equipment, unnecessary motion, that impedes the workflow and also affects processes. It can lead to fatigue, mistake, and even affect the overall efficiency in the lab. Okay, the last but not the least is the E, which is excess processing or extra processing. Well, this implies unnecessary step in the testing process like redundant data entry or repeated testing of samples that have already been tested, and these extra steps waste time. Generally, all these downtimes, what they do at the end of the day is to waste time, resources, and can cause delay in delivering results. So by identifying and eliminating these 8 wastes in the laboratory can lead to enhancement of the processes of the lab, reduce costs, and improve accuracy, and deliver timely, high-quality results for patient care. So that's about the downtime. Okay, here, this slide is also showing the 8 downtimes, which I already explained. Now, how do we implement lean principles in the laboratory? Okay. Now, there are 4 basic methods that can be applied in implementing the lean principles in the laboratory. Remember that I said that lean is all about, like as the name implies, cutting down, okay, on wasteful processes so as to increase efficiency in the lab. One key approach, one of them, there are 4 of them. One is value stream mapping, followed by standardizing workflows, 5S methodology, and automation and digital solutions. And you can choose either of these lean principles to achieve efficiency in the workflow of your laboratory. So what is value stream mapping? Value stream mapping involves like creating a visual representation of the entire laboratory workflow. And you do that to identify the bottlenecks, inefficiencies, and areas of waste. So when you do a value stream mapping, you are trying to map each step in the process. And also you're trying to pinpoint delays or redundant activities. And at the end of the day, it's all to the end of like trying to streamline your workflows and focus on activities that add value to patient care and diagnostic accuracy. So let's go to standardizing workflow. Standardizing workflow is all about developing SOPs, which will go ahead to ensure consistency and efficiency in laboratory operations. These SOPs will provide clear, documented guidelines for staff to follow, thereby minimizing variability in processes, reduce errors as well, and ensure that each test is performed consistently and correctly. And this improves the overall quality and performance of the lab. Now let's go to the 5S methodology. The 5S methodology, well, what 5S means is sort, set in order, shine, standardize, and sustain. And all of them create a well-organized workspace, improving productivity and minimizing errors. So like sort is like sorting out everything so that you can provide easy access. You remove unnecessary items, keep only what is needed, and this can be translated to like getting more organized with everything you're using to work in your laboratory. Then set in order is to arrange these tools and reagents and equipment in such a way that promotes easy access and efficient workflow, like the first in, first out. We all use them in our laboratory organization. Okay, for example, the next one is shine. And under shine, what you're trying to do is to regularly clean. Do not allow your lab or your reagents to be cluttered. You regularly clean and maintain your equipment and workspaces to ensure smooth operations. Then for standardize is to develop clear and constant procedures to ensure that everyone, just like the SOP we mentioned, follows the same process. Then sustain is for you to ensure that the improvements you've already made are maintained and that continuous improvement is embedded in the culture of the lab. So the last but not the least in the lean principles is the automation and digital solutions. Implementing these automation and digital solutions helps in minimizing manual processes, enhance accuracy, increase the turnaround time, while ultimately optimizing lab performance and patients' outcome. So let's look at value stream mapping. Like I already explained, it's a lean tool that maps out every step in the laboratory workflow. It's like you have a big map showing all your activities in the lab. Then when you get like a snapshot of all your activities, you're able to detect which of the activities are value adding and the ones that are not non-value adding activities. Then you can be better positioned to remove the non-value adding activities, and you can now improve on your value adding activities. So its purpose is just to identify delays, redundancies, inefficiencies in processes, and the benefits is just like we mentioned, to highlight bottlenecks, optimize resource utilization, and improve turnaround time, which is the general overall purpose of the lean methodology. How do you implement it? Document the current workflow with a cross-functional team. You need a team. It's not something that can be done by one person. You get your whole team involved. We'll still get to that because it helps them own the process. It helps them own the activities you employ in process improvement. Then you are able to categorize steps as value adding or non-value adding. Then you develop an optimized process map. You now get a new map from this old one, develop an improved process map to eliminate these inefficiencies. Then we look at the Kaizen events. It's something that it's something that relates. Also, you can relate with the value stream mapping. This one is a short-term focused initiative that is targeted at rapidly improving some specific laboratory processes of interest. And it works by also getting your team together and collaborating them to solve particular targeted challenges. For example, such as reducing sample processing delays, improving turnaround times. Solutions are tested and implemented within days. Okay, so it's like a short-term thing with immediate feedback. You get your feedback immediately from your team, and its benefit is that it encourages teamwork and staff engagement. It also helps to deliver quick, measurable improvements in the processes of the lab, and fosters a culture of continuous improvement. Imagine when this is something that is continuously done over and over again in areas of challenges in the lab. It becomes a culture of continuous improvement in the lab. Standardizing workflows, like we've mentioned, is all about creating an SOP for your processes, and this, we know what SOP does. It ensures consistency and efficiency in laboratory operations. These SOPs will provide clear documented guidelines, like we've mentioned before, for the staff to follow step by step, and all to the end that variabilities are minimized in the processes and errors are reduced. It also ensures that each test is performed consistently and correctly, so that should you want to do it over and over again using the same standard operating procedures, you get the same result. You're most likely to get the same results, all other conditions being equal. And this improves overall quality and performance in the lab. Okay, we've discussed the 5S lean laboratory methodology. It's actually a cornerstone of lean. It provides a systematic approach, okay, organized approach to organizing and maintaining a clean, efficient workspace while achieving a smooth workflow and overall efficiency in the lab. So I've tried to break it down. Okay, so this is just like a summary also of the breakdown I've given you. Sort is to sort it out, eliminate expired reagents, redundant tools, and outdated equipment. This helps you to free up space, reduce clutter, and enhance workflow efficiency. Then you don't just end there. You go ahead and set them in order. Arrange frequently used items within reach and use labeled storage. Okay, so that it will help you to get the reagents whenever you need them. Then it minimizes search time and improves productivity. Shine is cleaning your area, establishing daily cleaning routines for your workbenches and equipment. This prevents contamination, extends equipment lifespan, and ensures accuracy. Then we've talked about standardization. You standardize, of course, whenever you hear standardize, you think about SOP. You implement SOPs for reagent storage, equipment maintenance, and waste disposal. Then what this does, like we've discussed before, is that it ensures consistency, reduces error, and enhances compliance. Then sustain, you continue, conduct regular audits. How do you sustain? We've said that sustaining is that you keep on doing it. And how do you do it? You conduct regular audits, training sessions, recognizing compliance. Then this helps to maintain long-term efficiency and prevent lapses and disorganization. Automation and digital solutions. This is about implementing automation and digitizing your processes. Okay, like what this does is that it minimizes manual processes and reduces human error while improving accuracy. And we know that simple routine day-to-day tasks like data entry, sample tracking, reporting can be handled by automated systems. And this is all to the end that time is freed up for the staff to focus on more complex and demanding tasks. What this does is that overall efficiency is enhanced, delays are reduced, and it helps to make sure that processes are standardized and are error-free. So let's look at the Six Sigma approach in laboratory QMS. What is Sigma? We've talked about the lean because lean deals with everything increasing workflow efficiency by reducing or minimizing waste. Sigma represents what it represents is that it represents the standard deviation of a process which measures variability. Six Sigma means that the process operates within plus or minus C standard deviations from the mean, which is the process average, before reaching specific limits. Okay, well, I don't know. Let me just try and delve briefly into the Six Sigma formula because it's something that is calculable in the lab. Okay, the calculations is beyond the scope of this webinar, but I'll just try to give a brief overview of it so that it will help us better understand what Six Sigma is all about. So the Six Sigma metric, okay, or formula is the maximum error. That's the TEA, the maximum error that is tolerable, okay, minus the bias over the coefficient of variation. Okay, let's use glucose testing as an example. Now, for glucose testing, the maximum tolerable error tolerable error allowable is TEA. And this is the maximum error that is clinically acceptable, like I mentioned, for a test. So for this one, you can either get it from a CLIA or other guidelines. Okay. So for glucose tests, the TEA is set as at plus or minus 10%. Okay. Now for the bias, remember I said the sigma formula is TEA minus bias over coefficient of variation. For the bias, this is the systematic difference between your lab's results and the reference or peer group value. Okay, so for a glucose testing in your lab, the lab mean may be 101 milligram per DL, while the reference value may be 100 milligram per DL. So the bias will therefore be in percentage, okay? And the formula is your own lab mean minus the peer group mean over 100 times 100%. So using this, our values, it will give 1%. So therefore, 1% is our bias for this sigma metric. Then for the coefficient of variation, we usually get the data for calculating coefficient of variation from the lab's internal quality control data over time. So suppose the mean, we are trying to calculate the coefficient of variation. Suppose the mean is 100 milligram per DL and the standard deviation is 2.5 milligram per DL. So coefficient of variation in percentage will be 2.5 over 100 times 100. So the coefficient of variation in percentage for us now will be 2.5%. So we've gotten our maximum tolerable error allowable, our bias, and the coefficient of variation. So to calculate the sigma metrics for this particular glucose test will be our TEA of 10 minus bias of 1 over coefficient of variation 2.5, and the sigma the sigma value will be 3.6. So what is the interpretation now? Because the sigma, remember we are targeting 6 sigma, okay? So if the sigma is more than or equal to 6, it is world-class performance of that test in the lab. If it is between 3 to 5.9, it is acceptable but may need improvement. If it is below 3, then it's poor. It needs urgent corrective actions. So for our results now, which is 3.6, the interpretation is that it is acceptable, but improvements may be needed because it's not up to 6 sigma. It's 3.6. It's 3.6 sigma. So it's between 3 to 5.9. Okay, so as we move ahead, you may understand it's something that is calculable, but remember that the target is to get to the 6 sigma value. But for the purpose of this discussion, we are just going to discuss the approaches you will take in the lab to achieve 6 sigma. This is the process you will imbibe in your own laboratory to gear you towards achievement of 6 sigma. So for a process with a mean and standard deviation, the upper and lower specification limits define acceptable performance. 6 sigma ensures that upper specification limit minus mean will give you 6 sigma. Mean minus lower specification limit will give you 6 sigma. This means that 99.99966% of all outcomes falls within acceptable limits. All get towards minimizing defects and improving reliability. So these are the things, these are the 6 sigma approach. We now get down to the 6 sigma approach, what we call the DMAIC methodology, which is a structured 6 sigma approach used to enhance laboratory performance and minimize errors. D is for define. Well, define means that the first step here, which is define, is to clarify clearly and identify key problems. Okay, so you're clearly identifying key problem areas within the lab. For example, high turnaround time, high error rates in test results. And once you have identified it, then you understand and define this issue, thereby allowing the lab to focus on them. Okay, so the aim of defining and identifying key problem is to help the lab focus on the most critical areas that need improvement. M is for measure. In measuring, here performance data is collected and analyzed. Key performance indicators and quality metrics such as result accuracy, turnaround time, error frequency, they are tracked. Then when you get the data, it helps you, it serves as a baseline for you to identify how well the lab is doing or where improvements are needed. Then A is for analyze. The goal here is to determine the root causes of inefficiencies. For example, specimen handling issues, equipment malfunctions, or staffing problems, which could be contributing to delays or errors. So by analyzing the data, labs can identify the underlying factors that are hindering optimal performance. I is for improve. Improve. Based on the analysis done, solutions are implemented to address the root causes, and this may involve workflow optimization, staff training, or equipment upgrades. Control. This is the final phase, and it involves monitoring and sustaining the improvements over time. This involves periodic audits, continuous monitoring of key performance indicators, and feedback loops. to ensure that improvements are maintained. Control measures are put in place to make sure that the changes remain effective and that the labs continue to perform at a high standard. So let's discuss root cause analysis and corrective and preventive actions. Root cause analysis, what it does, it focuses mainly on investigating underlying issues and identifying root causes, while CAPA, which is corrective and preventive actions framework, address the root causes, implement corrective actions, and implement preventive actions so that those actions you corrected will not be repeated again. Those errors will not occur again. So generally, it prevents recurrence. Root cause analysis is a systematic approach to identifying the root cause of errors. It reduces recurrence, improves patient safety, and ensures compliance with industry standards. It involves investigating the problem, gathering data, and analyzing potential causes to uncover the origin of the issue rather than just addressing the symptoms. So in root cause analysis, you want to get to the root cause of the problem, not just taking care of the problem on the surface. Why is root cause analysis important? Essential in laboratory quality management system. It reduces recurrence of errors. It improves patient safety and reliability of test results. Also ensures compliance with ISO 15189 requirements. So let's look at the common root cause techniques. Okay. The common root cause techniques we have available is the 5 whys analysis, asking why 5 times,
Yes, okay, it's our
asking
last one. Okay, it's our last one.
asking why 5 times to reach the root cause. Then fishbone diagram, what we call the, please can you put your mics on mute? Fishbone diagram, what we call Ishikawa. This identifies different contributing factors, and in identifying contributing factors, okay, it asks questions around the people, the processes, the equipment, the materials, the environment, just to get to the root cause of the problem. Then also we have the failure mode and effect analysis. This is a risk assessment tool that ranks failure risks based on severity, occurrence, and detection. So let's look at the 5 whys that can be used to cover the root causes of problems in the lab. Yes, it has its advantage because it helps to get down to the root of the problem. But you have to be careful because if misused, it can lead to incorrect solutions and yes, and give you the wrong the wrong answers. So you have to be careful while applying the 5 whys. So the first why, so it's just about asking yourself why 5 times. Now, the first why, you identify the first cause contributing to the problem. So why are test results delayed? Second why, you dig deeper by questioning why the first one happened. Okay, why are test results delayed? Because there's nobody to sign out the results. Nobody on seat, no pathologist on seat to sign out the test results. Second question, why is there no pathologist on seat to sign out the test results? Okay, because she was sick yesterday, and she couldn't sign out the results. Okay. Third why, So you continue drilling down and down until you get down to the deeper reasons to understand why the problems happen. We will still get down to, like prototype challenges that happen in the lab and how you can use root cause analysis to solve the issues. So common mistakes in these 5 whys, like I've mentioned, you have to be careful why applying your 5 whys, because if you don't use it well, you may actually arrive at a wrong solution. Stopping at symptoms, you may stop at symptoms instead of getting down to the root causes. You may be prone to jump to conclusions, failure to involve the right team. These are the common mistakes that can be made. Then using vague or generic answers, not verifying causes with data. It's important to verify your causes with data. Neglecting systemic factors, then lack of follow-up on corrective actions. So let's look at the fishbone analysis, the fishbone diagram, or what we call the Ishikawa. The fishbone diagram is a tool that you can use to identify and visualize the various factors that contribute to a problem or effect. It helps teams to explore systematically potential causes across different categories. Now, in order for it to be systematic, you have to ask your questions, or approach it systematically, like asking questions on factors related to human resources, including staff training, just to get down to the root cause of the problem. Is the problem due to factors related to human resources, including staff training, performance, and communication, or does it have to do with processes, issues in the workflow, procedures, or methods that was used, or does it have to do with the equipment? Are there failures or inadequacies in the tool, machines, or technology used in the process? It can even be the materials, the raw materials, the reagents, the consumables. Okay. Do they have quality issues or availability issues? Are they in short supply, or are they expired, and all that? Then environment. Are there external conditions that can actually be contributory to the problem, like the temperature, humidity, or workspace setup that may impact the process or results? Okay, so this is just what we just explained now. So let's look at failure mode and effects analysis, which is still a tool for root cause analysis. We've mentioned yes, the root cause analysis tool. We've mentioned the 5 whys. We've mentioned the fishbone diagram, that's the Ishikawa. We are now at failure mode and effects analysis. And what this is about is that it's a structured risk assessment tool used to identify potential failures. Here we are looking at what are the potential failure points. It hasn't happened, but this is a potential failure point in a process, product, or system. And when we get to identify them, we go ahead and evaluate their risk based on these 3 key factors: severity, occurrence, and detection. Now, severity. How serious is the consequences of a failure, of a potential failure? Okay. Higher severity means greater impact on safety, quality, or performance. For occurrence, what is the likelihood that this failure will happen? Does it have a high occurrence rating or a low occurrence rating? A high occurrence rating indicates a higher probability excuse me, of failure. Detection. What is the ability that this failure will be detected before it impacts the process or customer? Lower detection scores indicate a higher risk of undetected failure. So this is calculated by assigning a risk priority number, what we call the RPN, which is calculated by multiplying the ratings, because these three factors we've mentioned have their score ratings. So it is calculated by multiplying the ratings for severity, occurrence, and detection. The higher the risk priority number, the higher the priority for addressing the failure risk. So the more urgent the need to address that particular failure risk. This FMEA helps in prioritizing actions to mitigate risk by identifying critical failure modes and guiding corrective measures. So let's look at the corrective and preventive actions framework, what we call the CAPA. The CAPA framework is a systematic approach used to identify, correct, and prevent issues within processes, systems, or products to make sure that there is continuous quality improvement and safety. What's the purpose of CAPA? The purpose of CAPA is to address and eliminate the root cause of a problem or non-conformance that has already occurred. And it is all to the end that this issue is prevented from reoccurring in future. So corrective and preventive action is all about correcting a failure, an issue that has occurred, and it doesn't just end there. You go ahead and prevent reoccurrence of that failure or error in future. So let's look at the preventive action. Preventive action is just to also identify and eliminate potential causes. So corrective is that it has already happened, so you've corrected and it is taken care of. Preventive is that that thing you corrected, you're making sure that it's not going to happen again. So you place measures in place to make sure that it doesn't happen. So preventive actions are proactive and focus on reducing the likelihood of issues arising in the first place. So these are the steps for implementing CAPA in the lab. Number one, you identify the problem. Detect and document issues using audits, feedbacks, or complaints. That is how you detect what the problem is. Then root cause, get analysis. After detecting or identifying the problem, get to the root cause of the problem using your root cause analysis tools like the 5 whys or the fishbone diagram or the FMEA to identify the root cause. Then you can now go ahead and implement your changes, okay? Maybe like process change, maybe a process change, it may be equipment repair to eliminate the root cause. Then you don't just stop there. You now begin to develop proactive actions such as improved procedures or training. You can even go ahead and get a spare equipment to prevent future issues like that from happening. Then you go ahead and verify your actions. You assess effectiveness of actions. How effective is the action you've taken? Because you don't just end there, oh, I've taken the action and you go and sleep. The action you've taken, how effective it is. And this is all just to ensure that you've resolved the problem and it's not going to happen again. Then you document and follow up. Documentation is very important because it helps you to ensure compliance, and also to you also perform it in order to follow up and ensure continuous improvement. So what's the importance of CAPA? It helps in improving quality of the processes, products, or services. It helps in reducing risk, okay? Because when you address a potential risk, okay, you've taken it out of the way. Then it improves compliance. It's a critical component for ISO compliance, and it ensures that labs meet quality standard. And also, it supports a culture of continuous improvement, because when you are constantly correcting actions and preventing actions, then with time, the lab develops a culture of continuous improvement, and you find the organization continuously looking for ways to enhance their processes and prevent potential failures. It becomes the norm. So let's look at case scenarios for discussion. Okay, a hospital laboratory has experienced a consistent issue with inaccurate blood test results, leading to delayed diagnosis and potential patient safety concerns. The lab conducts tests for a variety of departments, including the hematology, clinical chemistry, and microbiology. Recently, there has been a noticeable increase in the rejection rate of samples. Why? Due to incorrect labeling and mislabeled test results. So, the lab's ISO 15189 accreditation is under review, and the lab manager has initiated an internal audit to assess the causes and determine appropriate actions. So, what are the key findings of the audit? Problem: inaccurate blood tests results inaccurate blood test results compromising patient care. What is the root cause? Root cause analysis was done, and breakdown in communication between the phlebotomist and lab staff due to unclear labeling procedures was observed. Then, what are the possible contributing factors? Lack of training, poor supervision, absence of a double check system. So, action: initiation of an internal audit. So, the question is, what immediate corrective actions should the laboratory take? What, from what we've discussed, what preventive action can be taken thereafter? And what role do digital tools play in reducing human errors? How can risk-based thinking and process improvement prevent future issues? Okay, let's answer the questions. Immediate corrective actions should be: first, the staff should be retrained on labeling, on sample labeling. Then double checks for labeling should be implemented. Then we go ahead and conduct an audit to correct mislabeling. Then what are the preventive actions? Train, training and retraining of staff. That's what I would say. Train as you're training the old, retraining old staff, you're training new staff regularly. You use barcode scanners for samples ID, just to eliminate human errors. Then you monitor the labeling consistently. What is the role of digital tools in reducing errors? Barcode scanners reduce identification errors. Automation tracks samples and minimizes mistakes. Then digital checklists ensure procedure adherence, which is very, very important, because it's not just creating an SOP, it has to be adhered with. So if digital checklists are in place, it will know when you have skipped one point, any point in the standard operating procedure of that particular process. Then risk-based thinking and process involvement improvement, sorry. identifies potential failures early. That's what it does from what we've discussed, and ensures continuous improvements. And this continuous improvement prevents issues from reoccurring. So let's look at risk management in laboratory quality improvement. What is risk management? Because are there risks? Yes, there are risks. How do we manage the risks? Okay, the first thing is to identify the risks. The second one is to mitigate them. Okay, risk is an error that has not happened. So we have to manage them before they become catastrophic, resulting in affecting patient safety. Okay. Common risks include sample mislabeling, equipment failure, reporting errors, biosafety hazards, which require proactive detection strategies like root cause analysis. Now, in the traditional lab, risk management are usually reactive, but according to quality improvement and principles of quality improvement and risk management, it is better for risk management to be proactive. It is better to imbibe proactive risk management strategies. And these proactive risk management strategies prevent errors through assessments, trainings, monitoring of quality indicators, while the reactive strategies address errors after they've occurred using CAPA and audits. You see, this is superior. Proactive risk management is superior to reactive risk management. So, importance of risk assessment is identification of areas for improvement, and it also guides continuous quality improvement. Proactive risk management strategies for lab quality improvement. Effective risk management in the lab, QMS, ensures one, patient safety, regulatory compliance, and operational efficiency, which we've been all about. Instead of merely responding to issues as they arise, it is better to manage risks proactively. And proactive risk management focuses on number one, anticipating and then mitigating risks before they impact laboratory operations. So the ISO 15189/2022 requires labs to systematically identify and control potential risks across all stages of the testing process. So as a laboratorian, begin to think about all the stages of your laboratory process, of each particular process in your lab. You should anticipate the risk, identify them, and control them across all stages. So identify risks at each stage. Every phase of the lab workflow, from sample collection to result reporting, presents unique risks that must be managed. And by analyzing potential failure points, laboratories can prevent disruptions and errors, because the downside with allowing risks to happen, failures, risk to happen, is that to occur as a failure in the laboratory system is that it just disrupts everything and causes errors. So we are advocating a shift from reactive to proactive error prevention. Like I've mentioned, traditional quality management often focusing on fixing errors after they occur, while a proactive approach prevents errors by implementing safeguards and process improvements in advance of the risk. So risk identification in the laboratory process. I've mentioned that all through the phases of the laboratory process, from pre-analytical, analytical, and post-analytical. So you're trying to identify the risk in the pre-analytical phase, analytical phase, and then post-analytical phase of your laboratory process. For the pre-analytical, you can look at sample misidentification, which is a risk. It's something that can happen. Poor sample transport conditions, incorrect tests requests. Then for analytical risks can be equipment calibration errors, reagent contamination, technician related errors. The list is not exhausted here. Then for post analytical risks can be data transcription errors, delayed result reporting, and misinterpretation of test reports results. Each of these phases has its own set of potential risks that can affect quality and patient outcome negatively. So how do we mitigate these risks? We've identified the risk. How do we go ahead and mitigate it? For pre-analytic, it's not exhaustive here, but these are the things. I'm just giving examples of things that can be done to mitigate pre-analytical risk, like barcode-based sample identification. If the problem is misidentification of samples or mislabeling, we can employ barcode based systems of identification, and this reduces mislabeling and tracking errors. Then phlebotomy protocols can be standardized as well, ensure proper patient identification, sample collection and handling. Then for the analytical, okay, it's all about ensuring accuracy during testing by regular instrument calibration and maintenance. Okay, just make sure that the equipment is functioning optimally and that precision is maintained. Use of quality control samples. Have control samples, validate your test accuracy and detect errors early. Then post-analytical, it's all about reliable reporting and interpretation, and this can be achieved by electronic laboratory information system. It reduces human error and improves efficiency. Then can double check critical test results. Okay, and this helps in not just it helps in ensuring accuracy before reporting. Okay, let's look at another case scenario. A busy anatomical pathology lab processes over 100 biopsy specimens daily. Recently, a near miss incident occurred where two patient specimens were almost switched. That's a risk. Remember, see, almost switched during grossing due to similar names and container labeling errors. Fortunately, the error was caught before slide preparation. The lab corrected the error and instituted a proactive risk management strategy. Now, what's the identified risk? High likelihood of specimen misidentification during peak workflow periods. Of course, had to go through the root cause analysis to find out that these specimens are likely to be misidentified during peak workflow periods, especially in the absence of a standardized verification process. So what are the solutions? How do you go about this particular problem? Okay, now you do a risk mapping. You perform a risk mapping on the entire specimen handling workflow to identify the vulnerable steps. So this is the root cause analysis. You can use any of the techniques here. Apply the failure mode and effects analysis. So a risk mapping was performed on the entire specimen handling to identify vulnerable steps like receipts, labeling, and grossing. Okay, then you can go ahead. Color-coded labeling system. Specimen, these are the solutions. Specimen containers and requisition forms can be color-coded by tissue type and urgency to reduce confusion. Another thing you can employ to mitigate this risk is a two-person verification rule. Okay, this can be introduced at the accessioning and grossing stages to make sure that the specimen and the patient identity match. Then also another solution could be barcoded tracking system. Barcoded labels can be scanned at every processing point to ensure that traceability is maintained, manual errors are minimized as well. Then you can also train the staff in order to mitigate this risk, train the staff and simulate drill simulation in the workplace and on handling high risk scenarios. Example, duplicate names, unclear labeling, and this can be conducted to improve the staff response and their alertness to these situations should they occur. So let's discuss continuous quality improvement in risk management. ISO, I will keep on mentioning ISO 15189-2022 update extends the concept of continuous improvement in laboratory quality management system to risk management. Okay. And it is risk management is not a one-time process. It's not something that we just do once and we go and rest. Oh, we've done risk management for the year. No, it's something that it's so long as that lab is functioning, it's something that keeps on going on. Okay, requires monitoring, requires improvement through the continuous quality improvement strategies. And the continuous quality improvement strategies is that means what we employ is just the Deming's cycle: act, plan, do, check. When you act, you plan, you do, you check. Now let's talk about continuous. We are still on continuous quality improvement in risk management. Want to talk about tracking key performance indicators, because you cannot effectively carry out continuous quality improvement in the lab without tracking, without the use of tracking key performance indicators. So these key performance indicators, they help labs to measure risk and performance over time, the trend of their performance over time. Common key performance indicators in the lab are sample rejection rates, turnaround time for urgent tests, error rates in laboratory reports, reagent stockout frequency, equipment downtime, then the customer complaint trends. So these are the common key performance indicators. Conducting internal audits and external quality assessments. It is important to conduct periodic internal audits as a continuous quality improvement strategy. It helps to drive targeted improvements and strengthen the overall quality management system. It's also important to participate in EQA programs, which helps laboratories to compare their performance with peer institutions or even reference labs, recognize deviations in accuracy of their tests or precision, and also you don't just stop there, you implement corrective actions. Benchmarking against best practices from audit findings and EQA feedback also helps laboratories to adopt evidence-based improvements, and it doesn't just end there. Align with national and international quality expectations so as to foster a culture of accountability and learning. So don't just allow what you do in your lab to end with you. Okay, you might not be conforming to national and international quality standards, which is the quality of an efficient and quality lab. A very important aspect of continuous quality improvement is developing a risk management culture, and it involves leadership commitments. The leadership of the lab must take an active and visible role in promoting risk management. It's not something as a leader of the lab, oh, you leave it for the, oh, let me leave it for the people working in the lab. It's not my business. Let them just produce results for us. No, you must be shown to be interested and actively involved and play a visible role. You set clear quality objectives, allocate adequate resources, don't leave them to their devices or just manage it as the way it is. No, you reinforce the importance of safety, accuracy, and compliance. It's also important to encourage staff participation. Yes, all staff participation, not just frontline staff, all of them. Staff should be empowered and encouraged to report risks without fear of blame. No punitive measures to be attached to any negative reports. They should be able to report risks, near misses, and process inefficiencies. Their involvement in identifying these hazards and co-developing solutions helps them to it gives them ownership and responsibility of the processes in the lab. It also fosters team trust and collaboration, and also helps them to develop this shared commitment to continuous improvement across the lab. In conclusion, the key takeaways from our discussion today is that Lean and Six Sigma, they are powerful tools for improving efficiency in the lab by eliminating waste, reducing variability, and standardizing the processes in the lab. Then also root cause analysis is very important as it helps identify the true sources of error, not speculations. Oh, I feel, oh, I think, oh, this person told me. No, it is database. You get down to the root cause, and it also enables effective corrective and preventive actions to avoid recurrence. Proactive risk management shifts the focus, like we've mentioned, from reacting to failures to anticipating and preventing risks before they impact quality and patient safety. Also, continuous quality improvement depends on a continuous culture of learning, team involvement, and data-driven decision making. Finally, bringing these approaches together strengthens patient safety, regulatory compliance, and laboratory credibility. My final thoughts: quality in the lab is not an act, it is a habit built through consistent improvement, vigilant risk management, and a commitment to excellence. Let quality guide every process, not the outcome. Thank you.
Over the cost of the flood is silly, all this
Uh, Hello, thank you very much, Dr. Onyinye Eze, for that very nice presentation. It was very straightforward. I think we have enough time to attend to questions, observations, and any comments. So you can unmute yourself if you have a question so that we can take that from there. Thank you very much. So we look forward to questions from the participants. Alternatively, you can drop questions in the chat box and I will assess them.
Hello, good evening. Can you hear me?
Manuel.
Oh, thank you very much,
You're
sir.
welcome.
Thank you. Thank you, the presenter. That was a good presentation and quite an important one for that matter. In fact, all the presentation has been good, though today's one was mad on my own side somehow by network issues. But I would want to ask, or rather raise a concern. Maintaining quality is most times costly. Okay, quality in the lab is most times costly. So, in a situation where, in our environment where we are always faced with trying to manage because the management will not provide the necessary materials, you are constrained. You want to manage this, manage that. So, how do we get to this level of efficiency that is being projected by the Lean and the Six Sigma principle? That's my question. I don't know if I was clear.
Yes, you are.
Okay.
Yes, I agree with you. If you notice the tone of my voice, I also spoke to the management. I know they may not be here because it's a common problem we encounter in resource poor settings. But my take on that's my personal opinion, because we tend to get our hands full. Okay. Why, even if we are doing the most basic of investigations, there are some basic things that we do not need a lot of resources to achieve. It requires, like what we discussed today, applying the lean principle, because in as much as we are in a resource poor setting, my experience in working in the lab is that we also accrue a lot of wastes. And my advice is that that's what this discussion is all about, the lean methodology, trying to eliminate all waste so that we can maximize resources. That little we have, what I am saying is that there's a way we can apply what we have learned today to eliminate those things that are source of waste, and also those wastes, we add them so that our workflow will be efficient. Even if we don't have enough resources, there are things that we can do on a small scale. We don't fill our hands with everything. When we start with those basic investigations we are able to do, okay, and imbibe a lot of excellence in it, I think we'll go a long way. Thank you. That's my take.
Okay, ma. Sorry, let me just chip in more to make myself clearer. I understand the aspect you've answered. Like when you talk about um, trying to eliminate these pre-analytical errors that comes by reason of mistakes, mislabeling, and things like that. You know, you talked about using a barcode system and things like that. I wouldn't know how many of us in our centers have that. Okay, and without such, even the issue of post-transcription errors, okay, that is post-analytical, is still occurring. And some of these things, there's no way you can manage it and without having those errors, except those equipments are procured. Then again, on the issue of maybe, I heard when you mentioned having to repeat, like when you get some those critical results, having to repeat. Okay, these are also challenges. For instance, you are running a test that costs like 25,000 or 10,000 naira. Okay, and this result is gotten is wrong with a cartridge. So when the result comes out, you see that you really need to check again, and you are now constrained. You are now considering having to use another cartridge, another 25,000, and things like that. So that's what I'm talking about. How do we? Is costly, and the materials are not there. How do we get over these kind of situations?
Okay, yes, thank you for using the barcode scanners to reduce ID errors as an example. Like I said, there are some things that we can do in our resource poor settings. In fact, it's just this thing is an area for policy advocacy, because our laboratory system is something that needs to be looked into. Okay, but remember I mentioned the double checks for labeling or double checks for lab processes. Yes, we don't have barcode scanners, but we can implement these double checks. Okay, even like in the lab, like in transfusion, all these transfusion issues. Okay, that is why these double checks are in place, what we call even down to collecting patient sample, what we call positive patient identification. You now go down to be very very careful at, as in your level of scrutiny, your sensitivity. I'm not excusing how our system is, but I'm trying to also bring in the things that we can do while we are very optimistic that things will get better. I don't know if I answered your question.
It's okay. Thank you very much. It's something that we just keep pushing. Okay, I
Yes.
like also the aspect of the advocacy you brought up. Okay, thank you very much.
Yes.
Yeah.
Thank you.
All right.
Good evening, ma'am.
Good evening.
Please, I'm sorry I was a little bit late for the presentation, but in the course of the presentation, you said that there are some times that we waste things in the laboratory. Please, could you be practical? I wish to understand where do we waste so that I can be able to, on my own, be able to conserve, because we're in a resource poor setting. Thank you.
Okay, where I mentioned wastes is when I was explaining the 8 wastes in lean, because lean is all about removing unnecessary waste. Okay, like waste of materials, unnecessary movement of people, excessive inventory that ties up resources, overproduction leading to wasted effort, defects requiring rework, and waiting time that slows down processes. Okay, for example, I'll just try to cite a few examples. Okay, okay, excessive inventory. Sometimes, we in our store, in our inventory, we request for a lot of things that we know that we don't need, we cannot finish, we don't even calculate how long this thing is going to last. Okay, we just request because we just want to be seeing them. Okay, these are sources of waste. Okay, for example, even in excessive production, okay, or over processing. Okay, the example I cited was duplicating lab processes. Like for example, my bias is blood transfusion. All right, sometimes when we go on blood drives, all right, some people will just do hemoglobin check, sorry, HIV rapid tests check for the donors. Do you understand? Then we'll now carry the collected blood, the donated blood. We go back to the lab, knowing fully well that we are going to do ELISA screening for these transfusion transmissible infectious disease on these blood samples. Okay, I think it's a waste of resources, because why don't you? That is why it was when it was noticed that this is a point of waste in the process. Okay, the rule now became just go there, collect the samples for everyone, then just go back and screen. Okay, some people in some labs they will do PCV and hemoglobin concentration. Those two tests are saying the same thing. So it's a source of waste. So that is one of the examples I'm going to cite in excessive processing. And I've mentioned that of excessive inventory, overproduction, defects requiring rework, wasting of materials. Okay, so that's what I mean. If there is any point such things are happening in your lab processes, just know that it is a source of waste. And the goal of lean methodology is to cut down waste so that we can conserve resources. Thank you.
Thank you, ma'am.
Hello, my hand is up, please.
Okay, hold on, please. We have a question on the chat room. It says pathology is one, despite having four different branches. So, what's the place of Six Sigma in medical microbiology, or is it meant for chemical pathologists alone? Seeing it's a set of mathematical formula for calculations. That question is from Dom Izundu. You
Please,
may
can you
please
ask the question again? I didn't fully get that.
Okay, she says, Dom Uzondo says, pathology is one despite having four branches. So, what is the place of Six Sigma in medical microbiology? Or
In
is it meant
medical
for
microbiology.
yes, or is it meant for chemical pathology alone, seeing that it is a set of mathematical formulas for calculation?
No, it's not. Okay. It's not just a set of mathematical formula. All right. If I'll try as much as possible to answer you, but I just try to explain that for you to approach this Six Sigma, okay, it's a mathematical calculation that you use to get there to know whether your lab processes are operating within these plus or minus 6 standard deviations from the mean. Okay. Now, for it's something that affects all pathology departments because when you look at the DMAIC methodology, okay, which is a structured approach towards achieving Six Sigma, you see that it's something that applies to everybody. I don't know if there is any calculable area in your laboratory processes. There should be in microbiology. If there is, fine, you can apply it to it. If there is none, you can still use the Six Sigma approach, which is the DMAIC methodology. Okay, to if your laboratory results are only qualitative, you can still aim at getting your results to be to get towards Six Sigma by using this methodology I've mentioned, which is if there is a problem, identify the problem area, measure and evaluate key performance indicators. Then you analyze the root causes of the inefficiencies. There's no lab that you don't get to see laboratory inefficiencies. Okay, then you now improve. Okay, using the data you have gotten, you use your analyzed data to improve and implement targeted solutions. Okay, before you can now maintain improvement by constantly conducting periodic audits and monitoring your performance and ensuring adherence to best practices. I don't know if I answered your questions.
Okay,
Someone
thank you very much. So, you can proceed, please. The person was trying to ask a question.
Yeah, thank you very much, Doc. I want to also appreciate the teacher for today, Dr. Eze. I really gain a lot, and I understand how much important is these two concepts that you have discussed today, especially on risk management, as far as the new ISO is concerned. I am Langwa Bernard. I'm talking from Cameroon. I'm a lab quality mentor, and this presentation was so important for me. Just to add to one contribution on the question you have already answered about waste in the lab, I want to cite an example of a case where I was mentoring a lab and I discovered a huge quantity of blood hematology analyzer for full blood count, the diluent. You see, the diluent was available in very large quantity and near expiry date. And so those are unnecessary wastes that we see in the lab on daily basis. There are so many of such which, if we use, can really use that model. We'll be able to identify so many more in the lab. And at the end of the day, we complain back at the management commitment. And then come back to the first question about lack of resources and a challenging management situation. It is true. all the labs, no management will be accepting at all time that you propose that I need this, I need an AC in the lab for the instrument, and they will just give. No. It's a challenging and a daunting task for the lab. But I agree with what Dr. Eze is saying, that sometimes the lab technicians keep complaining without even doing the basic things that they're expected to do. The laboratory technicians sometimes spend all the time complaining that we don't have money to do this. Meanwhile, the small basic things that we're supposed to do in the lab, we're not able to do it. So I think that Dr. Eze said, we can always look for another means to go about implementing quality without actually using sophisticated equipment, like the issue of the barcode that was coding was cited. There are other processes that we can identify and put in place that would not necessarily require money. At the end of the day, still having the quality or expected results. And while we do that, we have to understand that for management to be involved, we are supposed to have this management engagement. For any lab to enter into any system, any quality system, there is the need for that management engagement, whereby they need to sign a document to actually agree that they are ready to support the laboratory management system, which requires a lot of resources. So I think that way we can always implement quality. So my question, Dr. Eze, please, about the risk assessment, it is really, really important. And when it comes to CAPA, how do we measure the effectiveness of an action, of a corrective action? That's where sometimes I usually have challenges. You know, the standard says you must come out and say, okay, this corrective action was effective. What are the measures or the methods that we can actually use to measure the efficacy of such corrective actions? Thank you. Over.
Okay. Thank you so much for the feedback. Thank you for explaining, giving us more examples. Okay, yes, assessment of effectiveness of corrective actions. Yes, you can do it by, like I mentioned, you conduct an audit. Okay, you conduct an audit in the lab, check out what you have done, and also even feedbacks from your customers. I think I have mentioned it, from people that patronize the lab. Then even these suggestions, let me not call it suggestions, Dropbox feedbacks from other people. Okay, depending on what you're checking the effectiveness, you can assess effectiveness of an action even from the people that you work with in the lab that are actually involved in that particular process. So I think those are ways you can assess effectiveness of actions. And also you can look at the key performance indicators. Okay, these are, you can use your key performance indicators to assess how effective the corrective actions you employed are. Thank you.
Okay, we have a question in the chat room, and it says, we have a question in the chat room, and it says, how do we get management of hospitals to undertake these QMS lectures? Because they seem to be unaware of these issues being discussed, especially in the area of employment of the right personnel, acquisition of equipment, etc.
Sorry, please come again. I didn't get that clearly.
Madwanusi Anozie Chidegu says, how do we get management of hospitals to undertake these QMS lectures? Because they seem to be unaware of these issues being discussed, especially in the area of employment of the right personnel, acquisition of equipment, etc. Did you get that now?
Yes, thank you.
Okay.
Okay, this is my own personal take. Like I mentioned somewhere advocacy, because it seems that the lab is a very special area, and it's only the laboratorians that can actually talk about what is happening in the lab, and also the feedbacks that we get from lab users, like other doctors and patients, or even other organizations. So I think the advocacy starts with us. It is we that know how important quality management system is in the lab. Some of the people up there in the management don't have an idea. They don't even know the word. They don't even know that it's something that should be applied in the lab. So I think we should lead the advocacy. Like myself, what I do is that I don't allow my management to rest. They already know me. Okay. Whenever I come, my chief medical director will know that I have come to trouble. Okay. And you think that you're not making an impact. Well, as you keep coming, okay, remember the woman in the Bible that keeps on troubling this judge. He's like, let me do this thing before he or she wears me to death. So what I'm trying to say is that the advocacy starts with us. We have to say it. We have to say it as it affects us. We have to say it as it affects patient care. We have to say it as it affects patient safety. We have to say it as it affects patients' overall outcome. If we don't say it, nobody will hear it. Nobody will even think it's important. You know, as at a point, I had to involve my other colleagues that are not even laboratorians. And as they were hearing it, they were relating it to the challenges they are facing in their own clinical work with our lab results. And they had to join their voices with ours and start amplifying it. So I think that's what should be done. That's my personal take. Advocacy is one of them. Thank you.
Okay, thank you very much. I don't know if Maduanusi and Nozie Chidiegu is okay with that, or you want to ask further questions. We're still open to a few more questions if there's any other person.
My hand is raised.
Please proceed.
Thank you. Good afternoon, everyone. Thank you for
Good
the
afternoon.
presentation, Dr. Eze.
Thank you.
Since we know that even with the best intentions and best practices in laboratories worldwide, laboratory practice seem not to progress beyond the 4 sigma matrix. What level of sigma
Beyond
matrix?
what? Sorry, beyond what?
The fourth level, that's the sigma 4.
Okay.
Yes. What level of sigma level challenge challenge will you or target would you advocate for resource poor regions? Although I know that it's not easy to measure this easily, and I'm not sure we know what level we actually are at this point. It may even be level 1, or we are still on sigma 1 metric. That's my first question. Then the other one is how do we effectively, we are talking about lean management. How do we effectively or efficiently manage waste in the lab vis-a-vis retesting or rechecking of samples, and who should order this rechecking or retesting in your own experience? Because beyond trying to keep lean with materials, we also want to keep lean with time also. Thank you.
Okay. Thank you so much. If I got your questions right, you were saying that we in resource poor countries, we don't even know the level of sigma we are at. Okay, and what do we do to even know where we are? If I got you correctly, my own take is that it's high time we began to do audits. Okay, not just individual laboratory audits, but national audits. Okay, because just like I said, people don't even know what's going on in the laboratory. You know, statistics is what drives policy. Okay, so if we are able to, like, there was a time I was at national NHS blood and transplant. I saw that these people are doing continuous audits yearly, quarterly. they are doing their they will pick one particular process in their transfusion laboratory or their clinical and transfusion. They audit and they have national data. And nobody can look away from data, real-time data. So if we have to, I agree with you that we have to even know where we are, because we don't know where we are. And the kind of results that we bring out in most labs in resource poor countries, most of them are not even accredited. You will count by your fingers the labs that are accredited in resource poor countries. So it's high time we began to do an audit to collect national data that can actually tell us where we are and better equip us to know how to move from where we are to another point. If I remember your second question, you were asking how we can implement lean to ensure efficiency in our workflow. Am I right?
Well, yes, you are not wrong, but I was just saying, how do we manage that with resources and also vis-a-vis, you encourage us to retest or recheck sometimes. So who does this checking, at what level, at what cadre, and also considering that you don't also want to waste the time, your TAT, you want to keep it as tight as possible.
Okay, you're asking who requests a recheck of the lab investigation, or what informs that investigations should be rechecked. Is that what you're asking?
Yeah, it's convoluted. Yes, it's all related.
Okay, it depends, because that is why it is important for a quality management system to be in place in every lab. Okay, because if it's in place, if your results, and also that you're continuously auditing your processes in the lab, okay, if your results starts deviating, okay, from the normal laboratory mean, from what it should be, okay, and also remember that labs should also get involved in external quality assessments as you're checking against what your normal laboratory results is. You're also checking against your peer, what the results of the other peer labs or even reference labs are. I think I mentioned something like that. So if you notice a deviation from the trend, okay, then you know that something is wrong, and it's a pointer, okay, for you to go back and recheck what you are doing. Okay, you may notice that okay, for example, let me use an example. For example, we notice at one point that all our patients, okay, that do full blood counts in our lab, we are coming with thrombocytopenia. Other people might not notice. That is why it's important, okay, for verification to be done before any result leaves the lab. Someone needs to verify the results. In some laboratories, they don't do this form of verification. A pathologist should do this verification. It is recommended that a pathologist should do this verification. So if this verification is not done, you won't notice the deviation from the normal trend. Okay, we notice because of the patients we participate for full blood count, that all our patients were having thrombocytopenia. And also we have this culture also in our own like clinical laboratory, for every patient we see to do a peripheral blood film, which is kind of a quality control over the automated full blood count. We notice that these patients that come with automated full blood count report of thrombocytopenia, when we look at their peripheral blood film under the microscope, they don't have thrombocytopenia. Platelets are everywhere. So it's like a trigger for us to say something is actually wrong with this machine. Is either then that's where your root cause analysis comes in. Is it from the machine? Is it from the reagent? Is it from the method of collection? Is it from the EDTA bottle? Because all these can cause false thrombocytopenia. So I don't know if I answered your question to an extent.
Yes,
You
indeed.
can come from anywhere.
I just wanted to know who calls that shot, because we have resources that we need to manage. So is it the laboratory manager? Is it the quality officer? And although you said the
It can
pathologist.
be the it can be the anybody. It can be the laboratory manager. If he's the person that verifies the results, he will notice a change in the trend. It can be the doctor that is seeing the patient. When the result that the lab is giving is not like tallying with whatever clinical evidence you have, you may want to ask for a repeat of the lab results. It can be from the quality officer when he noticed that there is a compromise in the quality of the machine reagent, or supposing they have quality control mechanisms in place in the lab. Any of these people can call for that. Thanks. Sorry. I don't know if I answered your questions.
Very
Please.
well, thank you.
Thank you.
Okay, we have
Doctor, I
another
have a
hand
question.
up, I believe.
Yes, thank you, Dr. Eze. I want to ask, who is qualified to verify laboratory results? I know we have mentioned verification of results. Who is qualified to verify laboratory results, and what is the difference between verification and validation of the result? Thank you.
Hello, 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 good evening.
Good evening.
I believe hold on, please. I believe we are straying away from the
That's
topic
what I'm
of
thinking
today.
too.
So what we are going to do, we still have a session for May 5th on personnel requirements and all that. So we'll get to talk about personnel in the laboratory, who's qualified for what and all that. But for today, it is outside the scope of this presentation. Thank you very much. Please, do we have any other questions? All right, in the absence of any other one, thank you very much for your participation in today's session. We look forward to have you all joining us for a more informative, for an informative session next week, same time. I hope you found the information and the insights that have been shared today very valuable in the course of enhancing your laboratory quality processes. We would like to extend our sincere appreciation to the College of American Pathologists Foundation. They are the agency for this intervention. Um, we appreciate their generous support in making this webinar series possible. We also thank our facilitator, Dr. Onyinye Eze, for sharing her expertise and guiding us through today's discussion. If you have any further questions or would like to continue this discussion, please do not hesitate to reach out to us. Thank you very much. And before we close, I want to still reiterate that we would like to remind you that attendance tracking, for the purpose of attendance tracking purpose, try to log in or sign into the webinars with your real name. This will enable us to verify your participation and provide certificates of attendance when needed. We also invite you to join us next week for another session. Thank you very much. And for today, bye.
Bye.
Yeah, thank you.